and I live in Richmond, California.
Okay. Yvonne, how are you involved in the medical cannabis movement?
Well, I've been using cannabis for many years now. I started in San Francisco with Dennis Peron's big club on Market Street. So I feel like I'm a soldier almost. I've been dealing with this battle for a long time. I was there for the protest marches in the city, and I was sad along with everyone else when the feds came in and shut the club down.
Mm-hmm.
So my history goes way back. In fact, my number is 446.
Wow.
Yeah, so I've been around in the movement for a long time.
Okay. How did you find out about cannabis?
Well, I have multiple sclerosis, and I had a sister-in-law who had it as well. And when I was diagnosed, she came to the hospital and confessed to me that she had it and said the marijuana really helped her get to sleep and with spasms. And I didn't believe her, and I was really frightened. So I stuck with the medications the doctors prescribed until I couldn't sleep one night. And so I fired up a joint, went right to sleep, and I've been convinced ever since.
Wow. So, how does cannabis help treat some of your symptoms?
How does cannabis help treat my symptoms? Well, for instance, I have spasms in my legs where they bounce around a lot and I can't control them. If I take a couple of tokes off of a joint, the spasms ease right up and it stops the pain. I like to hit a joint in the morning because it eases the pain and the spasticity, and I'm allowed to get on with my day. I have medications that the doctors have prescribed, and they help somewhat, but they don't do it completely like the marijuana does.
Oh. So you mentioned that your doctors have prescribed you medicine that just doesn't work as well as cannabis. If you don't mind my asking, how many prescriptions do you have?
The doctors have prescribed medicine that don't work as well as my cannabis. I have 2 different pain prescriptions, 1 prescription for Valium. And you can imagine if I take the pain pills and the Valium, I'm a zombie. But so if the pain is really bad, I can use a little of the pain medication and a lot of the medical marijuana, and I have a good day.
Mm-hmm.
Suddenly, all the silly stuff, I see it as silly, whereas without the medication, I might become angry, which is bad for my disease.
Mm-hmm.
So it's really helpful.
Yeah. As a medical cannabis patient, what are some of the challenges you face?
The challenge is always getting good medication, but the clubs can provide you with good medicine, but they are so expensive. I can't afford it. So fortunately, I have some friends that grow for me.
You mentioned that your sister-in-law has MS. How do your other family and friends receive you as a medical cannabis patient?
Well, it's really interesting because I got married a few years ago and I invited everybody, my relatives, my cannabis friends, and other friends, and not all my friends use it. So my cannabis user friends were shocked at how many people that are in my life that don't use it. And these people, although they don't use it, they see the good it does me. So I don't know if they approve or not, but I don't care. my mother, before she passed, I did a documentary on medical marijuana and the DEA. So my mother said, if it helps you, go for it. Stand up for what you believe. So I feel fine speaking out. My sisters, they don't like it because they want to be squares, I guess, and they think I'm too old to be advocating this. But as a medicine, it's the best thing going. And I don't recommend it for young kids. But young kids aren't trying to be like sick and disabled people. So it's not, our testimonies are not attracted to them. And I don't feel like I'm doing anything bad. In fact, I've got a gang of grandkids. And they know kids are, they can get on your nerves. So they know that I've got to medicate. And they go into the other room while I medicate. One time, one of my grandsons had a friend over. And the friend kind of snickered and said, she's smoking weed. And he says, no, she's not. That's her medicine. She needs that. And I was really pleased. I thought, okay, this generation is going to get it.